to the third episode of Unlocking the Secrets of Autism. My name is Russ Raposa, and my three co-hosts are Karen Raposa, Michael Dressler, and Amy Dressler. The topic today is dental and medical office visits. While Karen Raposa is a co-host of the show, she's also a registered dental hygienist, and she's considered an expert in helping dental professionals learn how to provide proper care for patients with autism. She has co-edited a textbook titled Treating the Dental Patient with a Developmental Disorder. She is also a former assistant professor at Boston University in the Department of General Dentistry. And she was awarded the title as one of the top 25 women in dentistry. We'll be asking Karen some questions that we think other parents might also have about how to prepare their loved ones for a dental or medical visit. Karen will also discuss things that should be expected of the doctor or dentist before, during, and after the visit. So I will start by asking Karen the first question. Karen, tell us what a parent or caregiver should ask their doctor or dentist to provide prior to their visit.
Sure. I try to read as many surveys as I can about what parents wish happened before they bring their loved one in for a dental visit or a medical visit. And almost every survey that I read, parents tend to always say, and if you disagree, let me know, they always say they wish they had an opportunity to talk to the provider before they actually get there for the appointment. Because we know what it's like, being a parent as well of a child with autism, what it's like when you get there. There's so much anxiety. Your loved one is just trying to figure out what's going to happen, and you're almost in your head saying to the provider, just do what you got to do. Just get it done quickly, because the longer we're standing here talking and having a conversation, the more anxious my loved one's getting, and he or she's getting anxious, I'm getting anxious, and then it's never a happy ending in most times when the situation is like that. So one of the things that I encourage parents to do is ask that provider, could we have an opportunity to talk? If my child's appointment is in the afternoon, could we talk early in the morning before you see your first patient? If my child's appointment is in the morning, could we talk the evening before? So one other thing that I encourage providers to offer families is social story. And so we understand what that means, but for the benefit of the audience, a social story pretty much just means having the doctor or dentist or someone who works in the office take pictures with their cell phone. They can take a photo, it's suggested, of the front of the building, the reception area, the front desk, even the restroom or the places where medical care is provided, and every person who works in that office. Because what that allows is, it's interesting, Children's Hospital of Boston actually has these already on their website. So if you're bringing your child in for a visit in the Developmental Medicine Center, if you go onto their website, you can click the social story for that particular area in the hospital. And so it's not complicated for any provider to do this, and they can send those photos to the family so that they can show those pictures to their loved one the day before they're going. And it really just takes their level of anxiety from here when they just show up someplace and they didn't know where they were going or who they were going to see. Now they're so prepared. And I know our son does so much better at his medical and dental visits now that we've been doing that for such a long time, that he's so prepared. The other thing that I encourage providers to do, whether it's medical or dental, is to send items to the family so that they can share those items with their loved one before they come in. So a real good example is for a dental visit. Think about all the things that you see or that are used in a dental appointment that you never see at home. There are toys that are stethoscopes and blood pressure cuffs and things that you can buy for your kids, but kids don't usually see the Profi little rubber cup that you use. They don't usually see masks when they're at home, the suction. So I encourage doctors and dentists to send like just a box or something of that stuff so that the person can play with it a little bit, familiarize themselves a little bit with it. So again, it's not so strange or new when they come in for the appointment.
I find that all children are different and all anxiety levels are different, and I find that even the dentist offices are so different. We've gone to dentist offices that are a little drab and very nice looking. But how do the dentists actually, from their side of it, treat these children or even adults on the spectrum with, to be able to figure out how to treat all these different anxieties the same way, or how do they actually do this?
Yeah, because everybody's different.
Yeah.
There's so many.
Yeah. I will never forget the first day. So remind me to step back and talk a little bit about some things in general that they can do to help. But when we were bringing our son skiing for a full day, he was going to spend a full day in a ski school when he was young. They had me fill out about a 5-page document asking me, what does he like to eat, when he wants to use the bathroom, what does he say, all these things. And I got so excited because I thought, they get it.
Yeah.
They understand that every kid who can't communicate real well is going to have different likes and dislikes, and they want to learn about my kid. And all I could think of was, he's going to have such a successful day because of this. So immediately it hit me. Why don't we do this in dentistry and in medicine? Why don't we take time to have families complete a form? So I've actually developed what's called a patient information form, but there are, again, many of these forms that other hospitals and doctors' offices have developed on their own, and it is basically just a great way to learn about each individual person who may not be able to communicate those things very well. Or maybe the family doesn't have an opportunity to communicate them because, again, we show up at the appointment and they can't possibly ask us all those questions in the amount of time that they have to treat our kid. So this form, I encourage dental and medical doctors to send that form to the family, have the family fill that out and complete it, and hopefully they have that phone call before the next appointment and they have an opportunity to go through that form with the family. And boy, they really set themselves up for success that way, even if it's little things that they find out, like he loves the SpongeBob toothpaste. Well, then they're going to have the SpongeBob toothpaste there when that person comes back in. So great way to learn individually how to have success with all different types of people. Typical people, we're all different, but we can communicate those things. Some general things are, they really look at ways to reduce the sensory input, right? Think about all that sensory input when you're at a dental visits, even more than medical visits. You know, they lay you back in that chair and they haven't even turned the dental light on, and what's in your eyes? The fluorescent lights, right? The smell. When we first started dating, he used to say to me all the time when I would come home, "You smell like a dental office." You know, there's a certain smell to a dental office that you don't smell at home, right? So here's our kids. There's these lights in their eyes. There's this weird smell. What are the sounds you hear in a dental office that you don't hear?
The drills with the high pitch.
The suction,
electric
right? Another kid in the other room crying, right? So then there's all that coming in, all that sound. Taste, right? What is the dentist wearing on his hands that most people who are, even if it's someone who needs their teeth taken care of, caregivers may not always be wearing gloves. I don't wear gloves when I take care of my own child's teeth.
I have to say that I find sometimes when I go to a dentist's office, and Amy's been there, especially when Brent was younger, Amy's got a very calming way about her. And Brent would be much calmer if the parent stays calm. I think it's very important to it, you know. And
you're right.
What do they do for parents to make sure that that is
Already
done.
what I've said, Mike, imagine if you had an opportunity to talk to that provider
Yeah.
before you got there that day.
Right.
Your behavior would be so different when you got there because you'd know what the plan was. You would have already been able to ask all your questions, state all of your concerns,
Right.
have all of that addressed, right? So immediately that's going to change the way you behave
Yeah.
when you get there. So a lot of these things work in multiple ways to help that person. But so doctors and dentists really need to learn how to reduce all that input, all that sensory input. So, doctors wear headlamps. They don't need to have a big dental light or
true.
any overhead light.
Yep.
They could use white noise machines that so
Yeah.
that you're not hearing all the other sounds, or allow, I know children like to wear, sometimes children with autism like to wear something that drowns out the sounds.
Yeah,
You
the
see people on
headphones.
airplanes
Yeah.
wearing those. So
Noise
those could be
canceling.
offered, or music could be offered. And any way to reduce all of the smells. Why does a dentist office have to smell like a dentist office?
Right.
Right.
There's all this aromatherapy stuff,
Right,
right?
exactly.
And allowing, our son would love to be able to pick. He loves to smell stuff, so let him pick the oil. For me,
Right.
certain oils give me a headache, but
Right.
others
Love
calm
it.
me.
Yeah.
And so, allowing the patient to pick. So a lot of it is about changing or reducing all of that sensory input
Right.
for these
Sounds
individuals.
is a big thing now.
Yeah.
Sounds like the drills and
Right, and so
Right.
being able to drown that out.
lighting.
or,
Some
yeah.
lighting really upsets
Absolutely.
some
Right,
children.
certain
Right.
The sensory
lights.
stimulation.
I know our
Yeah.
son wears headphones most of the time, so he just keeps them on when he goes there. And sometimes he'll put SpongeBob or different things up on the ceiling, so when they're laying back in the chair, it's something pleasant to look
Right,
at.
but maybe
Other-
he doesn't. If no one has asked, maybe SpongeBob scares some
Right,
kids,
right.
right? So
Yeah.
you need to ask those
Right.
kinds of
Right.
questions.
Yeah, right.
And all of that is part of that form that I've developed to help, really understand what's going to help that person feel most comfortable when they come in. Yeah.
Sounds good.
And what about, after the visit, the follow-up with the child, and can people put dental plans or what their child needs to learn or keep track of on their IEP?
So that's a great question, because one of the things I encourage doctors and dentists to do, a lot of this is building a rapport with these families. If you want there to be success and you want someone to have lifelong dental health, it's going to take a partnership. Just by what the dentist does in that one appointment is not
Yeah.
going to take care of. That person is going to need care every day, several times a day, in
How to
order
brush
to
your
be
teeth.
healthy,
Yeah.
right? And so I encourage dentists and medical doctors to stay in touch, reach out, maybe 2 weeks just after the appointment, and see how things are going. You've made some recommendations about oral hygiene and things to do. How's the family doing with that? Some other really important things that no one ever told us. If your child is learning through applied behavioral analysis, we know rewards are provided. We know very often those rewards are food. And so families, dentists, medical doctors should follow up with the families and ask if they can be an advocate for trying to get food out of the reward system.
Right.
Because kids' teeth end up decayed, they end up with lots of problems because the foods that they're given for rewards all day long.
Right.
So I encourage dentists and medical doctors to, find out what kind of rewards are being used and encourage that it be something other than food to keep the mouth healthy. If we know all these kids, if they have a diagnosis, they have an individualized education plan. And what you just asked me, Amy, is critical, that toothbrushing be on the education plan. It should be one of the goals, because we know some of the goals include daily life skills.
Right.
And so those things are like the person will learn to dress themselves or wash themselves. Toothbrushing should be part of that.
Right.
It should
You would
be on
think.
that education
Absolutely.
plan.
You would think so.
It's
More important than some little grooming skills, even.
yeah, and sometimes the goal might be just that the person will allow somebody to brush their teeth for a
Exactly.
certain period of
Or
time.
use floss.
It may
Get
be
used to that,
something, yes,
Yeah.
texture
maybe something
and
very
sensation and
very
everything.
simple like that, but it definitely should be on that education plan. So it is a lot about relationship. I always love the phrase, people don't care how much you know until they know how much you care. And so as a medical or dental provider, if you show these families how much you care and you reach out and you want to be a resource for them and you want to help in their advocacy, there's going to be so much, a much better outcome as far as the health of that person
Absolutely.
overall.
Right.
Yeah.
And you're reducing the anxiety if you care.
Well, it's funny because when I teach this, a lot of dental professionals will say, gosh, I could use a lot of those same skill sets for people who just have anxiety,
Yeah.
right?
Well, most people have anxiety when they go to the dentist.
You're
I
right.
feel.
You're right. Actually, about 70% of the population
I believe it.
Yeah, I
has
believe
I'm one of 'em.
dental has a dental anxiety,
Yeah.
not a phobia, because those are the people who only go on an emergency basis, but a true
I think
anxiety.
there's
Yeah.
more anxiety going to a dentist than a doctor.
There is.
Yeah, for
You're not
sure.
in control of
Yeah.
it.
Yeah.
Something's being done to you and you're not in control of it. And
I'm
you
one of
don't know
those.
what's going to hurt and what
Yeah.
not or if
Yeah.
something's going to surprise you. So I have a lot of anxiety
Yeah.
going to the dentist.
I guess
I'm
I'm
pretty
one of
worked
the
up from the night
unusual.
before.
And part of, a dental fear is normal. Yeah, it doesn't really faze him much, and that is unusual. That's a small percent of the population.
He's a tough guy.
We all have a little bit of fear. I mean, somebody's going to put some sharp stuff in my mouth.
Yeah.
That's normal.
Right.
But anxieties that some people have, I mean, I was in private practice for 20 years, and I would have people who were so angry that the moment they walked in the office, and I'd think they were just an angry person.
Yeah,
But
they're
I'd
not.
see them out in the grocery store, and they'd be like, "Oh, hi, Karen, how are you?" And I'd be like, "Who is that person?" Right? But it was anxiety.
Yeah.
Every time they would come to the office, they'd be angry because that's how their anxiety presented.
So Karen, you're mentioning all these great things. We go to a specialized pediatric dentist and they're good and I like them, but they don't do all the things you said or mentioned. So how do you get your dentist on board with some of the things that they aren't doing that you think would really improve your visit?
So it's interesting because I hear from dental professionals a lot. They come to my course and they hear this and they say they realized that they were doing things the way they always did them and they were comfortable doing it that way. And as humans, one of the things we hate to do most is change. So sometimes we need a little nudge, and sometimes it can come very politically from a parent where you could simply say, hey, I listened in on this program. I heard a little bit about some of the things that people are having success with when they bring their loved one for a dental visit. And one of the things I heard was that there's this form. I'd love for you to learn a little bit more about Brent. And I think if I could find this form, would this be something that you'd be willing to kind of walk through with me? And here are some of the other ideas I heard. I don't think any dentist, if, like we said, people don't care how much you know until they know how much you care. Most dentists really want to do a good job. And they just may not have ever thought of it, may not have ever heard of it, and are usually open to those kinds of ideas. If it's going to help them be more successful and help your child be healthier, that's really the goal that you both have. And so I can't imagine they wouldn't be open to that.
Okay, thanks.
So Brent, when his last dental visit, they said that in the next 3 to 6 months he's having an issue where he feels that there's wisdom teeth one of the wisdom teeth are going to be impacted, and his advice was to have all 4 out at the same time. And I guess my question is, should it be a regular dentist that addresses this, oral surgeon? How would you approach that?
That's a great question, and both of our kids are kind of at that age for wisdom teeth. And when it's a typical kid, a lot of times it's just in the office. Sometimes they can do 2, come back, do 2 in the office. General anesthesia is a high-risk procedure. And it's one of the things that there's really a lot of controversy right now in the dental field, because there are some practitioners who feel like if a person's got a lot of behaviors and they can't guide that person well through the appointment, they're just going to go ahead and sedate them in the office. And we hear these stories about kids who don't come out of that sedation. And people, it's interesting, in society seem to accept that as an okay thing. What they don't stop to think about is it's actually a form of restraint. It's medical
Yeah.
restraint.
Right.
There's physically restraining
Right.
someone,
Yeah.
and there's medically
Medical.
restraining someone. And what you've done to that person is the same, either way. Now, you could argue, well, they're knocked out, so they're not experiencing it. But if you physically restrain someone and you're kind to them and you're gentle and everybody's safe, the outcome is still the same. And so there's the whole term restraint has actually gone away, believe it or not, in medicine and dentistry, and it's called protective stabilization. Because
Okay.
I am wanting to keep that person stable,
Right.
and I'm wanting to
Protect them from themselves.
Yes, so there's lots of discussion in medicine and dentistry about, is there a safer way to stabilize someone and still have the same outcome without the risk? Now, let's get back to third molars, those wisdom teeth, because if left alone, our kids could have some serious problems as adults, and that's the worst situation we could
Right,
put
it's gonna
them
be
in,
worse,
especially if someday we're not on this earth
Exactly.
anymore, and then they're having to rely on who knows what to make those decisions. So third molars, generally, most people do not have a jaw long enough to accommodate them. Even if the tooth does erupt, the gums around it can't shrink back far enough, and so there's always this space that bacteria gets trapped in, and then they end up with swelling, and it's just never a good situation. So for our kids, it is the best for them while they're young, and while the full root hasn't formed on the wisdom tooth, it's
okay.
easier to remove them.
Okay.
And so, and it's not
didn't
such a
know that.
deep hole, and so it is recommended that they be under general anesthesia for everybody's safety. Yes, it's the recovery's not easy for a typical kid because you've got a lot of space back there that food can get trapped in and things like that. But there are some really simple things you can do, and it heals. Our kids heal. Young people heal very, very quickly, and it is really the safest way to go.
What can we expect after the operation?
So most of the uncomfortable feeling is coming out of general anesthesia.
Really?
It's
Yeah.
it's the stomach upset. There
Okay.
could be things like that. I would ask. We've had one experience with Tommy under general, and we know that he actually does get a very upset stomach. So I'll be asking for some anti-nausea
Okay.
as soon as he comes out, because what we don't want is
No.
stuff
Right.
from the
Good
stomach
idea.
getting
Yeah.
into those
Okay.
sockets.
Yeah.
And generally, they haven't had anything to eat. They don't let them eat anything, so there's not a lot in the stomach. It's
Right,
usually
right.
just liquid, but that can be something to kind of watch out for. But they're not going to experience pain right away. It's going to come about 7 to 8 hours afterwards, because the
Okay.
anesthesia takes that long, all
To
that
get
general,
out, yeah.
and so you want, when they tell you, make sure you're giving them the medications for pain every so many
Right.
hours, do it.
Yeah.
Okay,
Even if
so-
you think they're not
So
in
do it
pain.
Okay, so now
Proactively.
he's got 4 teeth out, and he's in a lot of pain, and he's non-communicative.
He won't be in a lot of pain if
He
you're
won't?
giving the medications
Okay.
that they've prescribed every 4 or 6 hours, whatever they tell you. Just do it. Don't wait to see if he's going to need it.
Yeah,
just
just
do
do
it,
it.
because you
Okay.
want to avoid that situation. Now, the bigger challenge is going to be getting them to keep the ice on the face.
And the
Yeah.
rinsing and the stuff that you have to do,
And that's
the
not
aftercare.
critical, the
No.
ice on the face. If you can get them to deal with it a little bit at a
Yeah.
time,
Just to
it's
keep the
going to
swelling
help
down?
them to
Yeah.
keep the swelling down.
So how long are we looking at? Days?
It'll be probably by the end of the second, third day, they're going to start feeling a little bit more like themselves, because again, they're young kids. They're going to heal quickly, and
What about
that-
sleep?
Or eat?
they should sleep fine if they're not in pain.
Yeah.
That's the whole thing, is managing the pain, and so keeping them
So
on
they should be able to
that pain
sleep,
medication.
and they should be able to eat.
Yes.
How about foods,
Yes.
though? Should
Yeah.
be like
They,
soft
they'll give you
foods,
all.
right?
They'll
Yeah.
give you all those things to watch out for. No drinking through straws or sucking on anything, because you don't want the clots to come
Right.
out of the
I remember
sockets.
that.
Okay.
Yeah. So we want to hear from our audience
Yes.
for sure.
Thank
We-
you.
Can you
for
give the
tuning in.
website, the email address
Yeah,
again?
there'll be.
Okay.
So I think that
Autism
about
New
wraps it up.
Yeah.
Right? So thanks for tuning in, and please send your comments to autismnewengland@gmail.com. And
Yeah.
thank you from all of us.
Please let us know if there are any topics that you want to hear about,
Yes.
or that are important to you that you are wondering if we'll cover. We'd love to
Yes.
hear from you.
Yeah.
I want to hear what you want us to talk about.
Thank you.
Thank you.